All right. Thanks so much for being on this podcast with me. My first question that I have for you is tell the audience a little bit about yourself and how you started in the work that you do today.
Yeah, my name is Dr. Julia Lockyer. I'm a licensed psychologist in Florida and Massachusetts. And then I also do some telehealth therapy through what we call SciPact, which is kind of other states that are joining to offer online services. I originally got into the field of mental health because I had a roommate with an eating disorder, and I got very interested in how to help her. And that kind of fascination, along with my love of helping people and that kind of thing, led me to where I am today. I have gone down many paths. I was in pediatrics before, but really what stuck was LGBTQ population is what I really love working with.
Mm-hmm. So tell me a little bit about the work that you do nowadays.
So right now I do individual therapy mostly, some groups, but I do advocacy for LGBTQ and do individual therapy for a lot of trans clients, a lot of minority clients who really don't have an outlet to be able to know what to do next in this kind of upheaval that we're
Mm-hmm.
facing.
Yeah. And so what sorts of modalities do you use as a mental health professional to
That's a really
for
good
these
idea.
for these populations? Yeah.
Good idea to ask that. I use mostly CBT, which is cognitive behavioral therapy, some ACT, which is acceptance commitment therapy, and some multiculturalism and humanistic. So all that to say, there are different range of modalities that you can really use to see different clients. So I really take the individual into account. If the individual is very motivated and likes doing homework, maybe I'll use CBT. If the client is more feelings oriented, I'll do emotion focused therapy and always using a multicultural lens. So making sure that they feel heard and seen is really important. So you cannot do therapy without taking into the context of where is this person coming from, what's their norm, and really not over pathologizing if this is a result of their environment.
Mm-hmm. So tell me a little bit about the multiculturalism and humanistic modality that you use, because I've never heard of that before.
Yeah, so multicultural aspect of it. I went to Pepperdine University in LA and I had some wonderful professors, Dr. Bryant Davis and Dr. Shelley Harrell, and they really had me challenge some biases that I had going in. And it's really a matter of opening up your lens to seeing the context of what people are coming in with and not stereotyping or putting people in boxes and really seeing them for who they are. If it's a minority client, say, for example, we know from research that they're going to be under more stress. That's just a fact. So, if the brain's under more stress, they're more susceptible to getting mental health conditions. So, it's not that minorities are, you know, just higher rates of mental health because it's just the fact of living in an environment where they're under stress, maybe scanning their environment for safety, for example, with the LGBTQ population being attacked by bigger systems, that kind of thing. And being aware of that as you make decisions and educate on how to go about doing that. And then ACT is really more mindfulness based. So it's kind of like being an observer of your thoughts rather than trying to change your thoughts. For example, we would say something like, oh, I'm having the thought that it's warm in here, rather than saying it's warm in here. Because having the thought kind of distances you from the thought and lets you be an observer of it. This really helps when you have self-critical clients who are really hard on themselves. And we see that a lot in with disabilities, right? Because trying to fit the mold of something, you end up getting maybe spoken or unspoken messages that something in you is broken or wrong. which is not the case. So we have to rewire our brains and really be mindful of what we're telling ourselves and how much are we believing as fact and how much are we believing because that's what we've always told ourselves.
Mm-hmm. You mentioned this a minute ago. But what I wanted to ask is, what is the correlation between minority groups and, mental health? What's sort of the research that you've done on that, if any?
I have not personally done the research. I've read about the research, right? So I can send you some articles on that, but it's called the minority stress model. And so the idea, put in kind of simple terms, is that people who are in minority statuses, they have more susceptibility to having a mental health disorder. It's not that they are, um, you know, it's anything wrong with them. It's just the stress that your brain is under constantly, of scanning your environment. Is this safe? Is this not safe? Do I fit in? Do I not fit in? That stress on the brain can really impact your functioning and it takes away your attention from other things.
Mm-hmm. And that's pretty fascinating. So, what have you learned in doing this kind of work?
I've learned a ton. I'm constantly learning. You're never done learning in this field. And every time you think that you know what you're doing, someone will humble you, right? So that's the beauty of this profession is that everyone's their own expert on themselves, in my opinion. And we can't make assumptions about other people. So if we can make interpretations and give our opinion, but really I see the biggest growth in when clients come in and they're kind of feeding on every word you say and taking it as gospel, but really they're not doing themselves justice by saying, wait, does that really sit with me? And so when I hear them start to say, well, that's not really my experience, or yeah, I can see where you're coming from, but not really for me, that's progress, right? Because they're standing up for themselves and being able to really speak their truth. And that's what matters. It's not what we tell them that's going on, it's what they really, what resonates with them and what they feel like they can do to grow and change.
Mm-hmm. And is there anything that you as a mental health professional would like to learn in terms of something new or that you're curious about? That you're like, yeah, I'm
Yeah,
curious about this.
absolutely. I'm curious about so many things that it's endless. I think I'd really like to get more into more structured trauma modalities. And so just learning a little bit more about what can help different populations, how to approach it in different ways, because trauma is also very delicate work. And we often see it with in the LGBTQ community because we have vulnerable populations. And so we often see more trauma in this population. And so you're not really ever without a trauma lens, but really working on it in a systematic way through like EMDR, for example, or ART. I would really like to kind of grow and change and learn those things as well.
Mm-hmm. My next question, my last question, I guess, is what advice would you give to other mental health professionals coming up in the field that want to learn about, minority populations or other groups that have been sort of, um, like, what's the word? Kind of like turned away or kind of overlooked.
Okay, yeah. I would say be open-minded. That's really key. And be open to making mistakes and getting feedback. I think that's the most important thing is once you're open to feedback, you can grow so much. If we're just kind of stagnant and think that we know everything, we're missing the big picture. So, really being humble and curious about someone's perspective, but not making assumptions about it, and being willing to check yourself. So, we all have biases, we all have internalized homophobia or internalized transphobia. It's a matter of getting in touch with that and questioning it and saying, what? what messages have I received to lead me to this? And is there something I can do on my own to reevaluate that and approach this differently? And working through that is so important, right? So being able to get feedback from clients of like, that didn't really sit well when you said that to me, and being open to saying, oh, I'm sorry, like that wasn't my intention. What can I do differently?
Hmm. My kind of bonus question, I know I said this was my last question,
That's
but
okay.
my bonus question is, what can be done for mental health therapists to sort of, be more open-minded and kind of be more aware of when working with these populations? Because again, like you said, people have a lot of biases and they don't know how to like deal with clients that are different from them. So how can a mental health therapist sort of check him or herself to like, okay, I have to listen to this person and what they're going through. How do you sort of be in that space?
Totally. I think that, you know, there are a couple of things is one is training, right? Like getting more education on the topic and exposing ourselves to different people than different perspectives than we have. And knowing that, everyone has their own story. And when we can really know someone's story, it's really hard to not like someone when we know their story. So really allowing someone the space and time to open up at their own pace and not really forcing it or acknowledging that you're not going to be everyone's favorite. Like you're not going to be everyone's therapist. It's just not possible to meet everyone where they're at, and being aware that it's not personal, it's just something that they need to be able to find their own comfort and safety, and that's their right, and they really should exercise that right. So really being aware that we have our own biases and we need to check them, in the sense that being aware of like that funny feeling in my stomach when this client comes in, what can I do about this? Well, bring it up in supervision and get some, or if you're already licensed, get consultation about it, and don't sit on it on your own.
Mm-hmm. All righty. Okay.